are here today. So many of the individuals who we're serving on the job are navigating aging alone. Sometimes it's by choice. They don't want other people to be helping them, but oftentimes it is by circumstances. Things happen and a person winds up without having those extra supports in their life. Now, many of us are trained to work not just with the individual, but with the family systems who are supporting the person and the people in the community who are supporting them as well. So when someone is going it alone, we can wind up having some discomfort and have some troubling questions like who is their safety net and who's going to help them carry the load as things progress. We know that as the person is going to move forward in their aging process, they're probably going to encounter more and more obstacles. And we can wind up wondering, how can I help in this situation? So if you've ever felt that uncertainty, if you've ever felt that discomfort in supporting individuals who are aging alone, you are not alone because we're feeling that. Those of us who are here today and develop this content, we're feeling it. And today is about giving you a clearer path to move forward as you are supporting older adults who are aging alone. So we are your team here from Rutgers, and we come from many different departments here. Edna and I work at the COPSA Institute for Alzheimer's disease and related disorders, and we have a clinic where we see individuals who have memory disorders and their caregivers, and we support them with the diagnosis and medication management. We have a helpline. Edna and I have individuals who are solo aging calling us on the phone pretty much daily. So we're dealing with kind of this challenge all of the time. So we have Laura, who is joining us from the Rutgers Continuing Education Office. So she is making sure that everything is going well so you can get your continuing education credits. And she's here to help us with the tech stuff. Laura is also a social worker, so she has lots of experience in the social work area here. And then we are so fortunate to have Dr. Michelle Zechner not only presenting with us today, but for her work over this past year developing the material that we will be sharing. Michelle has been researching and creating all year long in order to make this day happen. So Michelle has a breadth of experience with older adults and with mental health as well. She's an associate professor at the Department of Psychiatric Rehabilitation and Counseling Professions at Rutgers University, where she teaches. She conducts research on older adults and people with mental health conditions. She does health promotions and wellness, and she consults on aging to mental health providers. Michelle's also a licensed social worker, and she's worked in nursing homes. She's worked as a case manager for older adults and also in a public guardianship office and in inpatient mental health settings. So Michelle has designed some great materials for us today, and we kind of have a sense of some of the things that you are struggling with. We just didn't decide on this topic because we wanted to talk about it. We do a needs assessment, which we did last year, and we listen to what you're sharing with us over the years and all of the trainings. So that's why we are talking about this today, because we know that this is something that many of us are struggling with on the job. So thank you everybody for typing in chat and letting us know that you are here. That is your attendance check-in that you are here, and that will help us with the CE process later on. So if you fill out all the paperwork, you can get 1.5 continuing education credits. So please respond to any of the emails that you are going to get from the Rutgers CCE office in order to complete and get those CEs. So type your name in chat there for us, and then follow all the prompts that you will get after our session as well. So also, after you type your name in chat there, we would love to know, where do you work and in what capacity? And we'd love to hear what part of the state you're from as well. Yesterday, we had people from way up north and way up south in New Jersey. And we know there's lots of differences in our state as well that can impact older adults and the services that we're able to provide as well. We have some friends from Monmouth, from northern New Jersey, from South Brunswick, senior center directors, Monmouth County Division of Aging Services, APS, Wonderful. Burlington County. We have Asbury Towers, Affordable Housing, APS in Hunterdon, Family and Children Services in Monmouth, APS in Middlesex. Lots of APS friends here today. Hoping to hear from you all later because I think many people are calling APS related to solo agers. So keep typing in there and letting us know where you're from. Atlantic County, wonderful. So we have friends from down south, friends from up north in Union, Essex County, wonderful. Thank you, friends, for continuing to type in there and let us know where you are from and what your role is. We probably have some social workers, some I&R workers here today, some nurses with us as well. We know that you have a lot of experience on the job, so we look forward to you sharing with us in chat, and we may have time to unmute and you can share with us a little bit there. We are going to have a Zoom room as well where you can chat in a smaller group with some of your colleagues. So thank you, everyone. We are recording the session, so thank you for being mindful when you are sharing. Let's not use any personal identifiers for any cases that we are sharing as well. So thank you everybody for typing in chat and letting us know about where you work and what you do. Our roadmap for today, hopefully by the end of our time today, you're going to be able to talk about some of the unique characteristics of solo agers. You're going to be able to explore the challenges and opportunities of aging alone because it's not all bad. For some people, it's a choice, and there are lots of positives about that. We hope you'll be able to discuss the best practices for supporting solo agers and that you'll be able to apply the tools that we are going to share with you to help reduce isolation, to improve safety, and to protect autonomy for our older adult friends who are aging alone. Everything that we're going to share with you is very nicely summarized in beautiful handouts that Dr. Zechner has created for us. So hold tight. You're going to get those after our session today. You are free to copy those, to print those out, to use those on the job, to share them with your colleagues. And there are handouts that are designed for you to share with the older adult who is aging as well, to kind of give them a roadmap. You can actually be working on these documents together. If you aren't registered for this session, please make sure that you register or type your email into the chat here for us or email me privately if that works for you as well. If we don't have your email, I can't send you the follow-up handouts, and I know for sure you would like to see those. So we're going to start with a short video, so let's watch this and then we will check in on it.
Oh no! Your college roommate's wedding is in 4 months? And
Sorry, but we always have a little advertisement here. We're skipping through that soon.
you just realized you've been hiding your smile since you were a kid?
An elderly man picked up the phone last week and placed a heartbreaking call to 911. Turns out it was a wake-up call about a growing problem that has gone unnoticed. Here's Dr. John LaPook.
Clarence Blackman is an 81-year-old Army veteran battling prostate cancer. But cancer wasn't the reason he called 911.
What I need is someone to get to the grocery store and bring me some food because I need to eat something.
I thought, well, you know, I got to have an instant response. And I figured I know that 911 responded very quickly.
A widower since 2011, Blackman came home from the hospital last week to an empty fridge and had no one to help him. In a recent report, Dr. Maria Carney of North Shore LIJ Health System says a quarter of Americans over 65 are at risk of becoming so-called elder orphans.
It's hard to age even when you have a good support system.
So does it sound familiar? Would love to hear from you in chat. Have you heard about other cases like this? Have you supported other older adults who might be calling your organization? Maybe you're called out to support somebody who got home from the hospital and needs food. So would love to hear from some of our friends. Does that sound true for what you are experiencing on the job? We have not, but that is extremely heartbreaking. I know, isn't it? 100%. So I think it happens more than we're aware of. I think sometimes people don't know who to call to help. And Cindy is sharing, yes, we have a congregate program in our building and can arrange for meals to be delivered. And M is sharing, makes me want to cry. I know. And Ivy, yes, it happens a lot. So all depending on what our role is at our agency, we might be more aware of this. And Lila, our office does receive calls like this, and we see a lot of this in Morris County. And Natalie, yes, at times we connect them with Meals on Wheels. So it could be for so many things that people need support. Yes, we refer to Meals on Wheels, food pantries, volunteer shopping, and Yuri is sharing many times there is a nephew or other relative who might help. And one case, the solo ager got help from a neighbor. So sometimes the person is trying to piece together a plan, right, from people who might live nearby, but sometimes family lives really far away and they're not able to help. We deliver meals to clients in need. As soon as they call in, we put meals together for them. And we have a food pantry here, and I will bring a couple bags of groceries to clients. What a lifeline that is. So good to hear that we do have programs in place in probably all of our counties to get immediate support out to our vulnerable older adults. But sometimes people don't know who to call, right? It is such a dilemma when Meals on Wheels has a wait list. Wow, just like so many other programs, right? You know, back to our topic yesterday, moral distress, right? When we know there's a need and it's hard for us to meet that. And it's a shame that the hospital does not screen for this before discharge. Don't get me started. We have had hospitals put older adults with dementia who could not go home by themselves. They stick them at a cabin, they send them home. So, and Emma is sharing, we have Meals on Wheels services and nutrition sites to which we support our consumers. We work to educate on these programs and services to educate the public. That is so key, right? Educate the public. We want people to know about this before they're in the situation that they need help. And hopefully, we're going to get some good tools to do that today. So, our agency also has a food shopping service for homebound seniors, and volunteers do the shopping. I love that. So, getting other volunteers involved to help support and building that community. So, and Jay Kramer is sharing ours does as well. So, type in, let's keep the chat going here. Love everybody's input here. Are you serving people who are aging on their own? We've had many of you type in here that you are supporting them. So, answer that question for us. And also, what do you find challenging when supporting solo agers? What do you find most challenging when supporting solo agers? Edna?
The calls that we get, we have a lot of solo agers who don't want help and they think that they can do it on their own. And then they need an intervention because the loved one that's far away or a neighbor, sees something and they're like, I'm fine, I'm fine, I'm fine. And we know that they're not. So that's the
Right,
challenge when someone doesn't want to get help from someone, even though they need it.
right.
When
Go.
they are
Thank
when
you,
they are
Edna.
picky, when they are picky,
When
Vicky
they're
just said,
picking.
and that's
Right.
that's true.
Yes, exactly. Elizabeth, I have clients who live alone with no family, some in senior housing. At least they can find support with neighbors and building social workers. The ones on their own homes may have nobody to reach out for help. That's a really good point. If you're in a building, you have more access to community. That's so true. How does an aging adult find out about these programs? I find that's a challenge. So good. So true. Wanting to connect them to services such as Jack, but they have trouble filling out the paperwork, which can be really lots of obstacles there. Communication barriers, Casey is sharing and Sheila is sharing. Age friendly in Ridgewood. Welcome, Sheila. And we have several solo agers come to the Hunterdon County Senior Center programs for services, and they say that the Senior Center keeps them going and the support they need for each other 100%. Sometimes clients have burned a lot of bridges. So true. Some clients get Meals on Wheels, but we find their fridge is full of the uneaten meals or has expired items. And yes, it can be challenging because some people do not want the help. And then it does become an urgency eventually when it likely could have been prevented. You're right. Then we don't have a choice and we are calling Adult Protective Services, right? So great challenges that are shared here. And I'm sure many of us can relate to these. And I'm sure we're going to think about some others as we are going along as well. So thank you everybody for typing in chat there for us. So let's look a little bit more at who are solo aging. Who are solo agers? We can define this as older people without dependable family support, and either they're living alone or they're caring for someone. So, at COPSA, we support individuals who have memory loss. So oftentimes mostly we're dealing with the caregiver who may be supporting the person who has Alzheimer's disease or another neurocognitive disorder. And really that caregiver is a solo ager because the person that they're supporting doesn't have the ability to help them at all. So, that caregiver might have a heart attack or might fall or have some other emergent need. And the person that they're supporting, because of their advanced dementia, they can't call 911 and they can't help at all. So, even though there might be another person living in the home with them, that person isn't available to offer any support for that other person who is also aging as well. So, and for those of us on the job, it could be a new client who's coming into us for the first time for service. And at the get-go, they're identifying that no, they don't have anybody who is there for them and helping with transportation or doctor's appointments or legal things or financial things, or it could also be clients who have been connected with us for a long time for many different issues, but then there's a change in their relationship, or maybe somebody who they were dependent on, moves across the country, or maybe that person dies, or maybe that person gets placed in a nursing home themselves and then they're no longer available to support the older adult. So we can come to solo aging in a few different ways. And maybe you can relate to that from your own experience and the people that you are supporting as well. So, and let's look at our little pie chart here to see what some of the hot areas are here. It can be a lot of times individuals who don't have children, right? So oftentimes we expect that when we have children, the children are going to be there to kind of take care of us when we're older. If we don't have that kind of built-in person to kind of step in when we need it, that can lead us to being a solo ager. So that for sure is a big group of people. But we might have children, but we could be estranged from our children, or maybe our children have their own issues and they don't have the capacity to step in and to offer the type of support that we need. So, and maybe many of us have seen this as well. Sometimes Adult Protective Services has to get in when maybe the older adult is at risk of being taken advantage of from the other relatives who are in the family as well. So maybe we have family, but they're just not reliable family, and they're not family who we can kind of trust with the really important decisions that we have as well. We could be widowed or we could be divorced. Maybe we had a spouse who would have been there for us, but they died, like the story that we saw of our gentleman at the beginning. His wife died. Or we could be divorced, so that's no longer an option for us. I don't know. Have had a string at Care to Caregivers, and I, of couples who are divorced, and they're coming back together again to provide support for their ex-partner who has developed dementia. So that's just been like, wow. Somebody's really stepping up to the plate. Sometimes that happens. Sometimes that does not happen. So that can put us more at risk of not having the supports we need. Many caregivers, as I explained before, if you're providing support for someone who doesn't have capacity, they're not there for you. So you're really solo aging. And often women, we see a high percentage of women as well who are solo agers because women do tend to live longer. So chances are they might outlive some of their other family members who would be there for backup support for them as well. And when we look at the demographic shifts that are happening with the baby boomers getting to be older adults now, 21% of people 50 years and older are growing, or or the numbers are growing about the people who are aging, who have no supports and who are solo agers. And maybe you see this at your workplace. Do you see more people, are more people reaching out to your workplace who are aging on their own? Would love to know about that. So type in chat and let me know about that. For care to caregivers, I think we're definitely seeing a rise in this. People who are calling for supports for themselves and don't have any identified helpers at all. So maybe you're seeing that for yourself as well. So type in chat and let us know about that. So we went over a little bit of what some of the challenges are. We're going to look at maybe a positive side to this, because we know some people choose to age without other people around. Some people don't, but we're going to look at the benefits of this as well from one person's perspective.
Hi, everyone. I'd like to talk about 10 benefits to living alone as an older woman. First thing is independence. Independence to and independence from. Second is personal space. You can do whatever you want with your home. You can make it look just like you want it. Control over your home environment. You can keep the temperature warm or cool. There's no one arguing about it with you. You get flexibility. You can come and go as you like. You can get up in the middle of the night, have a cup of tea and coffee and a cookie. No one's going to judge you, so you're totally flexible. Peace and quiet. No arguments, no disagreements, just exactly the way you want things to be. So reduce conflicts, of course. Improve mental health. You can actually spend time doing things that you really want to do. And I think it's a great time for reflection, for looking at yourself, doing some things for personal growth, and just, preparing for the future. A sense of accomplishment, that you've done something really positive with your life, that you're leaving a legacy, and that you can contribute to the world going forward. Just some benefits.
So we have some comments about that in the chat here. So usually, Natalie is sharing, usually it's a neighbor reporting a solo ager, right? Somebody who sees the papers piling up. And many of my clients have a minimal support system. So you're seeing that definitely a lot on the job as well. And Casey is sharing, this woman is amazing. So yeah, this definitely kind of sees the positive. This could be a reason why some people want to push people away who want to support them, because, hey, I want to live my life the way I want to live my life, and I don't want people telling me what to do. And one of our friends is sharing, many do have children, but they live far away or cannot help because of busy work schedules, family, or they themselves are disabled. 100%. I think that rings true for many of us here with the cases that we do see. So, so benefits of solo aging. What jumped out for you about that? Did any of that resonate with what you hear the older adults who are supporting for the reasons why they don't want to invite people in? Freedom to do anything or nothing. That's a great thing. That can be a high value for people, right? Some other older adults who we're serving might not want to be alone. They might be kind of frightening for them, and they might want to have other people around. But some of the older adults who we're supporting might want to have that freedom and that independence. Oh, Michelle put down in their temperature control. Right. Love that you can put the thermostat at whatever you want and nobody is going to complain. So, and Vicky is sharing everything she said plus. And Casey is sharing, I have solo agers who love having the choice of whether or not to wear clothes that day. I love that. Love that. So, so it's just good for us to kind of keep this in our minds as well, that yes, there are tons of obstacles and challenges, and it can make the older adult very vulnerable when they do experience a crisis in their life. But on the other side, there can be some positive things about that too. And Trudy is sharing, I think in-home counseling that we provide can help with independent living. I love that. Thank you, Trudy. Type more in there what county you're in and who you work for and how people can access the counseling services, because we love to hear about that. So it was interesting. Michelle and I offered this in person as well. And I was up in northern Jersey in Morris County, and our participants that day really had a strong reaction to this video because they said that, this is really the ideal that somebody's kind of choosing to live alone and it's all going well for them. And she looks like she's well resourced. She probably has a safe place to live and enough money, and her health looks pretty good too, right? But for many of us, the people who we might be supporting, things might not be going as well. They might not have as many resources. Their housing might not be stable. They might be experiencing some physical or some mental health issues, which is not which is preventing them from having, that self-actualized life that we all would love to have when we get to be older. So, if we get a diagnosis that's kind of limiting us physically, we might not be feeling all the positives about solo aging. So it's just good for us to kind of remember this. And if anybody has anything they want to type in here about this story from our friend here, does this ring true for the people who you are supporting who are solo aging, or does it look a little bit different? The people who are solo aging, are their stories different than our friend who is sharing right here? So you can type in chat and let us know about that. I will for sure read your responses aloud. So, and as you're doing that, I'm just going to go over a few of our categories here. So things that we have to think about when we are supporting solo agers. And don't worry, you're getting all of this in the handouts and great little tools that can kind of help you uh, help solo agers walk through each of these. So we have to think about the financial challenges, right? Yeah, it'd be great to live alone, but sometimes people can't afford that, right? And where you live, Michelle's going to talk about that a bit later, about where you live can impact how well you're able to age with minimal supports as well. We have to think about marginalized groups that, LGBTQI plus, might are already at a disadvantage. And if you're going into aging, you might already be further behind in being able to navigate things successfully for yourself because you've already been a part of a marginalized group. And Diana sharing, we have seniors who live alone and probably shouldn't be. Relatives live close by, but we feel they should live with them. Oh, thank you for sharing that. So, and again, what we think would be good for the person might think, no, I don't think that would be good for me. Or the family might not be agreeable to that as well. So autonomy is really, really important for many of our older adults, and many people shared that in our chat here, that sometimes the older adult is really resistant to having other people involved because they don't want somebody else calling the shots for them, where they're going to live, or, what they're going to eat. Maybe they don't want the home delivered meals because they really like to eat a certain type of food, and, it doesn't really suit their culinary palate. So, but that's can be very, very important for solo agers, and we want to make sure that these topics are included in the conversation with them. Definitely the lack of identified helpers. So this is something that we will work a lot with solo agers, is let's kind of map out who are your helpers. And Michelle's going to talk about different layers of helpers that we can have. It's so important to have advanced directives. So when that person gets in the space that something physical did happen and health care decisions need to be made, and they are unable to speak for themselves, that their medical providers have clear direction on how to proceed with their medical care. Very, very important. And we have resources for that as well. Because we know what happens when people don't plan, they wind up being in a situation that they didn't want to be in. Maybe they wanted to stay at home and they wanted to live out their end days in their own home. But if things weren't put in place to make that happen, there might not be a choice and they might need to wind up going to a nursing home. So this is all of our friends who are here at senior citizen centers. You can do so much to educate your older adult population and to help them plan so they can have success if they find themselves being in a situation where they are a solo ager. So, and we're going to have lots of resources for you for that as well. And we know for many people, we don't want to talk about this stuff. We don't want to talk about the time when, I might be alone and have no one to support me, or I might get a diagnosis of a chronic debilitating condition. I don't want to think about that. When that comes, I will deal with it at that time. And we've all seen this because these are probably the people who are reaching out to us for supports. That time does come, and then it's kind of too late to get all of the systems in place so I can live the way I want to with the condition that I have right now. So this success can come, or we have a greater chance of having the life that we want when we're aware of what might be involved for us down the road and we're taking steps to help kind of plan for this as well. So please, anybody, senior citizen centers, anybody from your ADRCs and your offices on aging offer programs for older adults to kind of start to be thinking about this. Sheila is sharing. For many, it wasn't really a choice to live alone due to the loss of their spouse or partner. I rarely see people who are happy about it, but because they are resilient, they deal with it. An issue many face is loss of income when they lose some of their Social Security benefits or spouse's pension. 100%. In addition, staying in the house alone becomes difficult and expensive, but there are not enough affordable options for low income affordable apartments. Sheila, you just kind of summed everything up there, right? It's complex. And yes, many people are not choosing this. And there are so many obstacles to just their housing security and their economic stability as well. And Em is sharing had a solo ager a few years back, had a doctor and a lawyer in her home. She refused to give up control. It was her choice. Yes, we see that all the time. We have somebody who we're supporting now, and she is a lawyer. She doesn't even have a power of attorney. So, you know, so, you know, like the doctor's kids have no shoes, right? So yes, we see this as well. So thank you everybody for sharing in that. So things that we definitely need to be considering. We know that from the solo ager's perspective, the person who kind of is putting up those walls and doesn't want to invite people in, we want to acknowledge that they are independent, right? Like Sheila mentioned in her chat comment, that there was a lot of resilience. People might not be choosing to do this, but they are doing it. And it's showing how resilient they are, that they can bounce back from lots of challenges. Sometimes people have family or other extended people in their community, but they don't reach out and they don't want to reach out to them because they don't want to be a burden. This is a huge thing for our older adult population, not wanting to be a burden. For some, it could be a cultural issue. It could be a larger cultural issue, or just maybe in our family. We don't ask for help. We don't tell people what we're struggling with. We're expected to kind of take care of these things on our own and not seek support from our county or from mental health providers. So that can impact it. Past trauma. So we've seen many families who, could use extra supports, but in the past they had some trauma and they're afraid now to kind of reach out and to let other people in, maybe to let like a home health aide in to support them in the home, or even to call and get a financial screening from the Office on Aging to see what they might be eligible for, because they might be afraid that that could put them at financial risk if somebody knew what their financial status was. There can be so many challenges asking for help. Some of our friends have already mentioned that they have seen that with people don't know where to turn to. There can be communication barriers as well. Some of our friends in chat have already mentioned that if we're socially isolated, if like you're living in a senior citizen building or congregate housing, you're going to have contact with people, and you're going to have like a building manager who's going to be there, and hopefully educational programs that are going to tell you about things, and people who are going to maybe be looking out for you a little bit. But if you're living by yourself in a rural area, you can really, really be alone, and that could compound your situation as well. And then if you're receiving long distance caregiving as well, that can be hard. The person, you might talk with them on the phone every few weeks or every month, but they're not really seeing, like our friend mentioned, that, yeah, they got Meals on Wheels all set up. But hey, when you open up that refrigerator, all those meals are there. They're not really eating those meals. So if somebody isn't there and they don't have eyes to kind of see what's going on, we're kind of missing out on things. So let's check in with, we just went over a lot of information here, so let's check in. Any of these three questions here, what do you want to share with us? What strategies are you using now when you're supporting solo agers? Or maybe you have solo agers who say, I don't want to be a burden to anyone. Is there anything that you say to them that kind of gets them to kind of soften up a little bit and accept some assistance? So would love for you to type in chat there and let us know. A huge problem is the reluctance to ask for help. They were always independent and now might be concerned about asking family for help because family might take over their lives and the solo ager might feel less of a person. 100%. Yes, 100%. And Carolyn is sharing, I like to refer to a program that does daily friendly phone calls from either the police station, Project Reassurance, or other county service to make sure they are okay. Sometimes people will agree to this. It's less invasive. I love that, just that small contact. Carolyn, could you type in and let us know what county you're from? Maybe we have some other friends from that county as well, and they can look into Project Reassurance as well. That is a great suggestion. And Kristen is sharing, encouraging them to socialize. Yes, 100%. And our friend is sharing, provide resources so the client is aware of what's available to them. You're so right. Sometimes they don't know about the great programs that are out there for them. And Carolyn is from Mercer and Middlesex County. So if you're in that area, check out Project Reassurance. And she said that a lot of police stations offer this. So check in with your police stations and see if they do offer Project Reassurance. And Matthew is sharing, many people feel embarrassed to take any help, but we sometimes will say there is funding available and they wouldn't be taking the service from another individual. Love that. So tell them, you know, it's here. The funding is here for you. I think we had somebody share in a previous in our in-person session along these lines that when people say, no, 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 I really don't need it. I want to save that for somebody else who really needs it. The worker would tell them, no, if you don't use the money, then we're not going to have it available for people next year. So you would be helping out other people if you accepted this funding right now. So
that's exactly what happened, excuse me, with my uncle. He had a life alert and he didn't want to press it because he didn't want to bother anybody. And I said, the guy on the other end, his job depends on that. And if you don't press it, he's going to lose his job because he just didn't want to bother anybody. I'm fine, I'm fine, I'm fine. He was not fine. So sometimes we have to do that little bit of therapeutic fibbing to tell the person that it's okay to call for help.
right. Love that, Edna. Thank you for sharing that. And Diana sharing, we will pair some solo seniors with other senior peers who live with their families. And the seniors living with families can speak with their solo peers to give them advice, ways to ask for help. Oh, I love that. The peer support might be better coming from someone their age than a younger staff member. 100% absolutely positively love that. So these are great suggestions. Maybe you picked up something here from your peers that you can take with you to move going forward. And we're going to have lots of other great ideas for you too. But in general, just best practices are to present options, right? Nobody wants to be told what to do. We want to present what your options are. And many people have shared that they are doing that. And I give information on our office, show them the programs that they could qualify for and all of the benefits that are available to them. I love that. So you are presenting options. They do call back when they review it and come on their own will. I love that. So they have their own agency. Love that. So another best practice is to focus on their strengths, like Sheila mentioned earlier in the chat there, that people are resilient. Like if you're going it alone, we want to point that out. Like, oh my goodness, you are so resilient. Like I've observed you over these past couple months that we've been talking on the phone, and I see, how intelligent you are and how clear-headed you are and how thoughtful you are in considering your options. So instead of going in with this is what's wrong in your life right now, starting that conversation with this is what's right in your life right now and focusing on what their strengths are. Holly is sharing our line of work may also be creating feelings of burden with the scarcity of resources. The most vulnerable are prioritized. Many call for rides to the doctor, but have family or friends they don't want to burden, but might be turned away from an organization that are at capacity with individuals who truly have no support. Oh, thank you for sharing that, Holly. So sometimes there are limited resources, and we are kind of having to juggle that and reserving the resources for the solo agers who really, really do need it, and encouraging the other people who do have family support to rely on them as well. So encourage older adults to use a senior center. Start by offering a meal through congregate lunch program. I usually do this with the idea that you don't have to cook, and try to find programs they might be interested in attending. Encourage center members to become new members. I love that. So showing them, what might be available for them, offering them choices like Sheila's saying, hey, we've got this art program, we've got the Tai Chi program, you can come to a talk on, managing your finances. So giving them choices and then engaging with them in problem solving instead of telling them this is how you can solve your problem or this is what you should do to solve your problem. Having a conversation, having it be, a back and forth, and hearing what their ideas are and you sharing some ideas, but engaging in the problem solving process with them, and then discussing the person's priorities. So, as professionals supporting older adults, we for sure know what we would like to see happen for that person so they're safe on all levels and they can have the highest quality of life. But what we think might be most important for them might not be aligned with what is most important for them. So we definitely want to have their priorities be the main the main act for our conversations here. So, and I'm going to turn it over to Michelle now, and she's going to start to talk with us a little more in depth about supporting solo agers.
Thanks, Mary Catherine. And I'm just so excited and invigorated by the knowledge of all of you today in the chat. It's just been so robust. I really appreciate your wisdom and your experiences. It's clear that when we come together, there's just a rich wealth of information. So thank you for sharing all of that. We're going to talk now about a concept, maybe you're familiar with it already, called building it's a circle of care, basically. And this is the idea of purposeful supports that can help a solo ager stay independent, to stay healthy, and live longer in their own home if that's what they want. It's really the idea of an intentional group of reliable people that help solo agers with daily activities or any kinds of things that they may need. And they can really be a wealth of different folks in who are those circle of care. It might be friends of a person, or it might be a care manager, or some of you in those roles. It might be neighbors, as we've talked about. Faith communities often provide a lot of support to their members. It could even be a rep payee or financial support person, or a guardian, or a power of attorney might be part of that circle of care. What's really interesting is that when we were in Morris County, we asked people, so who else would you consider a circle of care? Like, who else are in those older adults' lives? So I welcome you to sort of put in the chat anyone else that you've seen who've provided support in a non-traditional way to some of the older adults that you serve. So we had a really great example. Go ahead and put that in the chat of who you've seen to support older adults as part of a support or a circle of care. We had a great suggestion, which I thought was really wonderful, and that was a hairdresser. So someone gave the example of someone who literally went to to the beauty salon every day. It was like on her walk, and she stopped in, and it turned out that the hairdresser actually was the person who made the call to the county to get some additional aging services. And I thought that's really unique. Um, oh, and someone has dropped in a home health aide. Absolutely could be part of a circle of care. Someone is saying a priest. Absolutely. Adult day programs. You are the rock stars, right? The adult day services provide so much support. Also, a mailman, excellent point, can see when the mail is building up. Landlords, that's really heartening, isn't it? A landlord occasionally helps when no one else can. Thank you, Matthew, for that observation. So you've probably seen this in your line of work that people build relationships. I remember so many years ago, I ran a public guardianship program in Pennsylvania, and I remember someone who was so resilient and resourceful. She went to I forget which local political office repeatedly. And so I would get calls from that political office saying, so and so is really unhappy and needs to get a ride to the pharmacy store or wants to have more groceries or something like that. That was an unexpected ally in the circle of care for the person. Um, Oh, wow. And then thank you, Em. You're saying that they call Meals on Wheels to see when the last time the person received a meal. That's great. And the Meals on Wheels volunteers will stop and visit. Thanks, Edna, for that. Uh, some folks look at the villages model in your area to provide a central hub for vetted services, volunteer transportation, and social opportunities. Sheila, that's great. I'd never heard of that, the villages model. That's really interesting. I live in Princeton, and we have a program here called Community Without Walls, where older adults get together periodically and support one another. It's kind of a form of peer support and informal support where people care for one another and try to arrange rides or make suggestions or referrals. So I think that there are a lot of different people who are helpful, and they may be alternative to what you might typically see. Next slide, please. So to build a circle of care, I mean, this is probably pretty obvious, but let's go through it. You can help that person really think about that solo ager. It's important to really think through, and we actually have a handout, I believe, a tool for this that we're going to provide to you, how to help people build that circle of care. Because solo agers, they may need people in different ways than people who live with family or other supporters. So first, it can be helpful to make that list of a person, of who is in the person's life, who talk to them, who do things for them periodically. Also identify their ability to help, like what do they do and how do they do it. Someone in South Jersey, when we presented this presentation, did mention that sometimes a circle of supports are not necessarily positive folks. Someone mentioned, and I've seen this unfortunately when I was working in the community, of older adults who were very vulnerable, and then someone who received a disability check or social security, and a friend would come by at the beginning of the month and quote help the person by giving them a ride or taking them to the grocery store, but then charge them a lot of money in order to provide that assistance. So it's also kind of balancing a person's want and desire to stay independent with, are they safe? Are they being taken advantage of financially or other ways? I digress a little bit, but so making that list of people who can help in someone's life, and then identify what they actually do to help them. Also, defining the roles and tasks that are needed. So making sure there might be a gap, like someone may really need, like we'll see a clip in a minute, but something that's really important to me is someone who could take care of my cats. Well, not everyone is willing to scoop kitty litter. My husband doesn't do that. So, helping the older adult figure out the tasks that they need and the people who might be able to do those things for them and matching that. Also creating a communication strategy, and Facebook group or a text group or some other way, maybe even old-fashioned phone calls or in person, so that all of the different helpers and supporters in the circle of care understand who is doing what. And I don't know about you, but a lot of times when I worked in home services, people would ask the same requests of many people. So like someone would be like, you know what I really need? I need a bag of mints. And so then suddenly you'd go to their house and there'd be like 5 bags of mints sitting on the end table and it'd be like, wait a minute, who brought all of this, stuff? So making sure that everyone's on the same page and always encouraging people to make the decisions that they can. Letting them be involved, making those decisions is really, really vital to helping them stay independent and feel safe. Next slide, please. So we're going to watch a really lovely example of a circle of care video, which is kind of a mix of paid caregivers, I think friendships. It's a little bit of a funny website. It'll take us a moment to get to that site, but I think looks like Mary Catherine is there.
I'm feeling like I'm not there, folks.
Okay.
So give me a second here to.
Okay, Mary Catherine, if you want me to show it, I will.
Sure.
Okay.
I'm going to stop sharing.
Okay. All right. Okay, you're seeing all the things. I'm sorry about that. We're rolling with the tech punches. Today has been an interesting day, so let me. Oh, you know what? I just did, Mary Catherine. I made the rookie mistake of not sharing my sound, which I did yesterday. I'm learning. We all learn. We all have the capacity to learn and grow, I hope. So let me click on this link. There we go. And I'm sorry we have a quick ad there, but we should be getting to the video in just a moment. And let me unmute.
She's like my mom. I'm that close to her. There's things I can do for her that I don't know that I can do for anybody else.
When I leave, she's all perked up because she has that social interaction. She needs that.
She's part of the fabric of my life. It's not a duty call. It's just, I have to know.
Until a few years ago, 89-year-old Betty Agee was able to drive, cook, and shower by herself. But all that changed after she fell and crushed a vertebrae in her lower back. She spent months in a rehab facility. Betty never had children, and her husband died 14 years ago. Her close relative, a niece, lives more than an hour away. A web of informal caregivers pitches in to help Betty stay in her Minneapolis home.
Well, when I met her, she could not walk. She just took long naps. So I would come here and I would make her breakfast. She would go back to bed. She's very determined. She sits on her chair and she says, I'm going to get up. I'm going to get over this. And now she walks without her walker sometimes. She's not supposed to, but she does.
I come at 8 in the morning and I leave at noon. There's days that we do the shower and things like that. In the afternoon, she'll call me or I'll call her, especially before evening, to make sure that Betty takes her pills or if she's eaten.
Sunday evenings, I'll bring some supper. We eat together, debrief, have a glass of sherry.
All right. So I think. Oops, sorry about that. I'm sorry. I'm gonna have to stop sharing for a moment here to get out of the video. And I hope that gave you sort of a sense of what a circle of care could look like.
Michelle, I can share.
Can you share? Okay, I'm sorry.
Yeah,
It's a little
moved ahead.
Yeah. So let's hear from you. How can we help clients create a circle of care when family and friends are limited? We had some suggestions earlier of the villages model, but any other thoughts that you have about how we can help clients to create a circle of care? Um, and who might be in that circle? You answered that already, which is great. You had some great suggestions. But are there any ideas that you might have for how you might create a circle of care in the circles that you're working on with folks? So go ahead and just put that in the chat if you have a moment. Thank you for your patience with our challenging tech issues. Next slide, please. We'll move on. Oh, someone suggesting the religious community, church, synagogue, or mosque, or their neighbors and friends. Excellent point, Elizabeth. Thank you. Neighbors, excellent. Thank you so much, Kristen. So a lot of ideas that we can get from people, and even thinking regionally of our New Jersey is so diverse, and we are very different. Those of you in the South or those of you near the shore, different than in the north and more rural areas. I know Hunterdon County, for example, really different than Mercer County. Oh, someone suggests older school-age children to visit and write. Excellent, excellent. Refer them to different services that can be supports like church, self-help centers, senior centers. Excellent, excellent ideas. Thank you very much, everybody. Really great suggestions. Asking the client who they're comfortable with and trust, that is really, really important. Absolutely. Thank you. So as Mary Catherine mentioned, we also want to mention solo aging and the environment. It's really so different across different locations, and considering that context of where the person lives and the kinds of resources that are available. Next slide, please. I think that we all probably look at attending to the safety considerations. That's probably the first thing that we do, is to help people think about reducing fall risks, looking at locks and alarms, establishing check-in routines. That's a great idea. The one about the police department station calling people and doing a check-in. My mom is in her 70s and her husband went away for a few weeks, and I decided to call her every day if she lives in another state, and I was like, this is your daily wellness call. And when my stepfather came back, she's like, I miss my daily wellness call. Helping people check in with other people to make sure that they're all right, and it sounds like some of you do that as part of your work. Oh, great. Oh, Sheila has a great suggestion of the local library weekend programs. That's wonderful. Postal worker and local librarians, you all are on it. Great suggestions for circle of care. Of course, we want to modify the space if the person is able, if we can, to try to, grab bars and things of that nature to keep it as safe as possible, and supporting financial well-being. Oh, Diane, excellent point. Cameras, and we're going to talk about that technology. So keep that in your back pocket. If the relative lives far away, the relative can notify the authorities if there's a problem. Yeah, these Ring cameras, or the other kinds of video cameras, really useful for people who are solo aging or people with disabilities. Aging alone, geography really matters. Costs in urban, New Jersey is so expensive. I don't even need to say that. I feel like it's obvious, but it's so expensive, particularly in the cities. The density, and there's a term called crowded isolation, right? Where there's a lot of people who are really lonely and living alone, but they're all living alone together and they're not necessarily talking to each other or connecting. So there's this crowded isolation. Also in rural settings, limited access to services, transportation, limited internet, limited connection and opportunities to connect. Also, suburban trade-offs. There may be more space, but sometimes that space is a problem for people who live in the suburbs. If you have a huge lawn, or those homes that, like, you walk in the door and you immediately go up the stairs or down the stairs. So that could really be a challenging. Wherever people live, we should be thinking about, and you probably do this all the time, the community outreach and peer services for planning, for referrals, for social connections, and practical action steps. So like how we can actually help people live independently. So let's take a moment and have you think about your location and geography. What supports solo agers in your community? What you've given us some great examples. If you think of any other programs that come to mind about the community that you're in and the supports, but things like, and you've already mentioned some of these, the in-home counseling, that's a wonderful resource if it's available, Meals on Wheels, the Adult Day, the case managers. Mary Catherine, am I missing anything?
Well, one thing that's coming to mind is what we had people share from around the state. Like if you live in a more rural area, it could be harder. Like you might have funding for a home health aide, but there might not be transportation for the home health aide to be able to go and get to your place. If you live in more of a city area, the home health aide might have a ride. So that's like a challenge that can be for certain people who live in certain parts of the state or more remote areas.
Absolutely, absolutely. Volunteer services are so helpful. Thank you. And Casey says we have many seniors who ask for a friendly visitor, but our challenge is not having enough volunteers. Yeah. Yeah, and technology has helped in some ways because there can be phone calls, there's a really great program. I think, and Mary Catherine, you have information about that at the end of the presentation, matching volunteers with college students. There's a new program. And yeah, that's really helpful. Oh, and then someone mentions a podcast. Thank you, Sheila, on using technology or AI robots that remind people to take meds and engage with them as the AI device understands schedule, likes, dislikes, news, games, music, etc. It's really the wave of the future. And we all need to fasten our seatbelts with technology and AI. We'll be talking about that actually very soon. You all are predicting the flow of this presentation very nicely. So it can be helpful when you're, thinking about someone also solo agers to think about their environment, the context they're living in, the context that you are in, what will fit, what will work. If you're in a more rural area, more agricultural area, there might be different kinds of resources than if you're in a city. If you're living in Newark, if you're living in Trenton, there might be additional resources that are, unique to that area. And thinking about culturally appropriate resources as well. So next slide, please. So engaging older adults who are solo agers, it's really critical. And I think it's just as if, with any other older adult, we want to respect independence as much as possible so that people feel like they are able to do the things that they want to do when they want to do it. It's also really critical to acknowledge previous experience with services. Some solo agers may have had a really negative experience. There's a fancy word for that, the iatrogenic effect of services, which means that when we provide services, we only want to help people, but sometimes people have really negative experiences with services, like particularly older adults where they maybe felt that their freedom was taken away, where they felt like their rights were infringed upon. So people may feel a certain kind of way, kind of negative about connecting with services and really withdraw from services. I know I saw that a lot when I worked in the community. So using motivational interviewing, a great approach is really just acknowledge, like if someone says to you, I don't trust anybody because they came once and they did this and that to me, like for someone who has like a hoarding disorder, perhaps, they came out and they took all my stuff. I don't want you in the door. Acknowledging that goes a really long way to build a relationship with the person and say, I understand that you had a really bad experience in the past, and I hear that, and I want to assure you that I want to help you, and maybe there are ways that we can work together differently this time. So that I would, definitely that's important to acknowledge. Also noting family dynamics, which we always do, but solo agers you all identified that in the chat already. You said, people may have burned bridges, there may have been a lot of difficult experiences. So family dynamics for solo agers may be very painful and difficult. Even if someone has no one left, that might be the source of pain for them, that they have no one left. They have no family left. So acknowledging that and sitting with the person and talking with them if they want to talk about it, or making a referral if that's appropriate to a mental health provider. Also, finding ways to normalize future planning. Mary Catherine started talking about that, and people, I see it in my own family, I see it in the clients that I worked with, that people don't want to think about a time when they can't help themselves, right? Like that is really, really hard. And yet, it's so important, it's so valuable to normalize that. A lot of people have, and the way I would go about that, I would normalize it by saying, a lot of people have concerns about what's going to happen to them as they get older. And a lot of people decide to make plans so that their preferences, their choices, their desires are in writing and we know what they are so that when and if that situation comes where you may need additional supports or other kinds of help or other kinds of housing, God forbid, uh, that we would know what you want. And so it's really a healthy, helpful situation to be thinking about the future, even as we age, because we want the best for ourselves. And I, as a person supporting older adults, I want the best for you so that you live the life that you want as much as possible, and supporting that person's ability to create support systems for themselves by creating a circle of care, by identifying who the people are in their lives, and if they need additional supports, which is often the case, right? That's probably why you're involved with a lot of the folks that you're involved is that they don't have enough supports, helping them find the supports that match what they need and maybe what they want. Maybe, I can't tell you, I worked in the state psychiatric hospitals and on the geriatric inpatient unit. And, I've run groups with folks and people say, what I really want is a boyfriend or a girlfriend. And I'm like, wow, okay. Like you make assumptions about people who have very serious mental health conditions and a lot of symptoms and health conditions, but that's what's really important to them. And so understanding what's important and helping sort of navigate thinking through that, and maybe that's the support that a solo ager wants as well. Also targeting transportation and helpers. So those are, and that's probably what you do every day, but for solo agers, getting around is really, really, really hard. And even with the services that we have, we have the access services, we have senior transportation services, it still can be tricky, particularly in counties that are more rural and you have to drive a little farther to get to anything, and those supporters. And then building a plan, a crisis readiness, what's going to happen, if you go to the hospital, where will you go to recover? Who will support you in those ways? Next slide, please. These are some suggestions that come from the literature for solo agers that really indicate what might be most helpful, and that's planning. Start early. Oh, so hard. It's so hard when people don't want to make that plan. I know, it's hard. People, resist it. But with compassion, with relationship building, you can help people start to feel more normalized about this. Also, advocacy, really, advocating for what they need. You all are doing amazing work, and the geriatric care managers are so powerful in doing the assessments of what's needed and how to find the resources, hopefully, that are available, and matching people up with that. Identifying housing options. This is a painful one. It's really painful, but letting people think about what location is important to you, what amenities, so to say, would be important to you. Meaning, like, do you want to look out and see a tree when you look out your window, or do you want to have access to other kinds of people who are like you, or speak your language? Thinking about that as the future comes along is important. And creating and developing solo aging services. I don't know, and I mean, I don't work, so Mary Catherine, correct me if I'm wrong, but I don't know that we have a lot of dedicated solo aging services in New Jersey.
I don't think so. I think the age friendly, the big movement that's going on now, I think that's kind of working on that. But no, I don't think that we do.
Yeah, and that's something I think that all of the organizations, all of us, we can advocate for to encourage the state to think about what are the solo aging services that might be needed. And I think peer supports are really, somebody brought that up. Thank you so much, whoever brought that up. Really brilliant idea because people need support. They need to feel lifted up. And there are unique issues about living alone and what caused the person to live alone. Oh, thank you so much. Vicky dropped in that in my experience with Latino population, culturally, most of them don't want to plan ahead. Thank you, Vicky, for sharing that. That's really important to also be mindful and respectful of someone's cultural perspective about planning, even when we know it's so important to, and maybe talk about hypotheticals. If, in the future, in 25 years, you might possibly, whatever, maybe preferences, maybe it can't even, maybe it won't get to planning, but maybe preferences is a direction to head to. Sheila, thank you. Sheila says transportation so difficult to customize it through county programs, Bergen County. So without individualizing it, makes it hard to encourage someone to stop driving. In these older suburbs, dependent on cars to get around, giving up driving becomes a problem. Absolutely. And now, it's interesting. We have Lyft and Uber, which are wonderful, and older adults are not always embracing of that technology. I laugh because it's definitely in my family as well. Edna, thank you. Edna says many solo seniors don't want to leave their large home, even though they can't handle it anymore. Thank you so much. Um, and so what's really critical for solo agers is healthcare proxy and power of attorney because things are going to happen. Also identifying two emergency contacts and future housing preferences, as we talked about. And one last thing is to really encourage one small action step per week. So for solo agers, it's really important to help people keep moving, keep making decisions, keep getting out of their house and connecting with people because that keeps people healthy and independent as long as possible. And housing is definitely a problem. Technology really promotes independence, so telehealth tablets and portals, medication management technology. There's a fancy picture of something. I've never worked with one of those systems, but maybe some of you have. Smart speakers and devices. I mean, a lot of these things cost money. There have been programs to help people get the technology in their home, but I think we need to also think about that. Fall detection and home safety. I've seen, the old call buttons that people used to life alert that they wore around their neck. Now people have like smart watches that they can push a button. And also plan for barriers and workarounds. Technology fails. Oh my gosh, yesterday Mary Catherine and I did the training and you all were with us and her router went down and then there had to be a workaround. So technology can fail. Someone also says, thank you, Sheila, hook people to legal services for preparing wills, living wills, and POAs. Thank you so much. Next slide, please. So any tech solutions that you have used, maybe you could drop those in the chat, and any backup tech plans that you have used when and if your tech fails. So if someone uses medication reminders or those smart speakers, is there any low tech solutions that you've worked around when needed? So if you'll go ahead and drop those in the chat. I want to get to the next slide. The checklist for solo agers really is that legal and health planning, emergency preparedness, tending to social emotional supports, thinking about daily living and home safety, technology and communication, using it as we can, phones and tablets, and financial and administrative planning. Oh, great. Someone's saying group chats with family members, making sure people have enough new batteries for their hearing aids. Oh, Diane, let me just tell you, those batteries and not to mention the cleaning of the hearing aids. Don't get me started on that. All right. Thank you very much, everyone. We're going to do a breakout session. I think it's really going to be a brief one. So, Laura, it'll be about 5 minutes breakout discussion, talking about a solo ager, Arthur, who lives in a suburban home and has for 40 years, never married, no kids. And he has only a niece far away, and they don't really communicate. He's had a knee injury that makes steps painful, and he spends a lot of his time on his first floor. And he doesn't really eat very much. He eats sandwiches and drinks soda. Pain is causing him not to leave his home and go to the senior center. He often forgets his medications, and several days go by without speaking to another human being. He doesn't have a healthcare proxy or power of attorney. So we're going to have you split up into small groups for 5 minutes just to talk about a situation like this or a solo ager, and two concerns for Arthur or for solo agers that you're really thinking about right now, and one action step that you might encourage Arthur or a solo ager to take on. So we'll be getting that set up.
And we're hoping to broadcast this slide into your breakout room. So just hang tight with us there for a minute. And thank you, everybody. We appreciate you unmuting yourself and talking with your colleagues in the room as well. Laura, could you just please remind me again, how do I broadcast the slide? Do I have to hit stop sharing?
Yes, and we're going to share again.
Okay. And just pick that one slide.
Mm-hmm.
Oh, and share to breakout rooms. Got it. Okay. Pick that and share to breakout rooms. Good. Okay. Think we're good? All right, so we'll bring everybody back at 11:52.
Yeah, that sounds good.
11:52. And Laura, you'll automatically make us all come back at 11:52.
Yeah.
Thank you. Thank you.
I accidentally got kicked out of my small group.
We'll get in another one. Hang tight.
I'm out of my room too. Sorry.
Oh, Marianne, we'll get you in. Hold tight.
No problem.
All right, Marianne, let's see. Oh, what's happening? Caitlin. Okay.
If you're coming back, we're getting you into a room. Hold tight.
Yeah. Let's see.
About that. And did we lose Mary Catherine?
No,
there she is.
There she is.
So we had really some rich discussions. I think we're going to kind of skip any kind of debrief with that, just because in the interest of time, I want to make sure everyone gets to their lunch on time. But thanks everyone so much for participating and thinking through solo aging. There were some really great ideas that came out. Next slide, please. Next slide, please. So in summary, really, solo aging can be unique. There's some really unique interpersonal issues. There can be unique logistical challenges for folks, but solo agers can live independently, safely, and expand their social connections. It's really valuable when we can support people to plan and take some actions for their independent living as well. So I'm going to turn it over to Mary Catherine now. Mary Catherine, you're muted.
Thank you, Michelle. So I was struck by the short conversation that we had in our room that some counties really have some programs that like other counties, if they could mimic those, would help improve services for solo agers in their county. So just be interesting sometimes if we could all get together to kind of share that and see how we could recreate that in our counties too. So we could have used a few more hours to cover all the topics here today, everybody. So sorry that we're rushing through the end here. I just want you to see the handouts that you are going to get and the helpful tools that you will have. Here is the circle of care. And this is a worksheet that you can give to the older adult that you're working with to help them kind of think about who are the people who can help me with the different things in my life at different times. So you give this to them. This is your great first. Here's another list that you can give to them about things that are helpful for them. Do I have my healthcare proxy? Do I have my durable power of attorney? Do I have my living will? Have I shared this information with trusted people? Here are the name of two people who I can contact if there is an emergency. Here's who's going to be notified if I get hospitalized. So this is just like a great map. Anybody who is aging by themselves, you can give it to them the first time that you meet with them, and then you can go over it in your upcoming meetings with them as well. So this is something that you can have. Another one. Sometimes it's best if we don't approach it hard. You're aging by yourself, and this isn't going to have a good outcome. So we need to get all these things done. Sometimes it works better if we start soft. And by that, I mean that I know it's really important to you that you're able to maintain your independence and stay in your house. So let's work on those things that can help that come true for you. So we approach it from that direction. So just having them collect all of that information can be really, really helpful. So, and my staying independent plan, if it is my choice and I do want to stay independent, these are some things that I can do that will help me be able to stay independent. And it goes over things like I can get a medical alert button if I fall and I can't get up. I can get a medication box. I can get a smart speaker so that can call out for help at any time. I could get a video doorbell, so it gives you all types of ideas as well. So, and then in the top, like for my daily connections too, because the social connections are so important. Who can I check in with on a daily basis? And here's that person's number. And when am I going to call them or text them? So it kind of helps the older adult stay on their plan to stay connected with people as well. So just in case you do get those cases, and we didn't have a whole lot of time to kind of delve into this, but when you really are worried about someone and they are by themselves, we have a great handout on the guardianship in New Jersey, so you can see what is involved in that. So you can read up on that on your own if somebody is vulnerable and they do need someone looking out for them. We have the handout for you on adult protective services if you feel like the person is in danger from themselves or from someone else in their life, then you make a referral to adult protective services and they will go out and they will investigate as well. So, and there are numbers based on your county. I'm sure everybody also knows their numbers, those numbers as well. Conversations to Remember is a great program, and we do have some people who use our services who are using this, and they will pair you with a group of students, undergraduate students and graduate students, like 3 to 4 students, and you'll get on it's not Zoom, they use their own app, so the person has to be able to download the app, and you get on this app and you talk with this group of your friends for like an hour once a week. And the older adult can see it as kind of a mentorship, like I'm helping the younger generation learn based on all the experience that I have had in my life. And it is even available for an individual who has dementia. We have people who their family member has dementia and they get on the phone call. They look forward to it all week and they sit and they talk with a group of students. Even when the person starts to have difficulty with verbalizing, they'll do things like music. They're trained to kind of engage the person. So this is a great thing for somebody who wants to have social contacts and has limited social contacts and lives alone. This is a great way to kind of add some additional support as well. So, and it's free, completely free. Another good way to kind of get at this, if we don't hit hard with you need your, 5 wishes and your advanced care planning to be done right away, let's just start with safety review in the home. So these are some non-threatening materials that you can copy, that you can distribute to the people that you are supporting. Here are some things that you can do to help you age in the way that you want to and maintain your health. Let's go over these things. Do you have access to the food that you want? Maybe this is how you get them to get involved in Meals on Wheels or go to the congregate housing site to get a meal, once a week or maybe even once a month. Do a safety review in the home. I see all these throw rugs. We don't want you to fall because we know that you want to stay here. So again, this is a soft way to kind of to start to have the conversations with the older adult about their living alone. So we talked about quite a few things. You are going to have all of these tools that you can use to kind of copy, share with the clients, share with your colleagues as well. And as we're wrapping up here and everybody is leaving the room, we'd love to hear from you. What is one strategy for supporting solo agers that you are going to take home from our conversations here today? Love for you to type in chat and let us know about that. What is one strategy for supporting solo agers that you are taking home with you today? And then once you do that, we want you to click the link that Laura put in the chat for you to sign out for the day. But we still have 2 more slides, so hang on with us. Casey is sharing the classes have been amazing and so helpful. Thank you so much for sharing your knowledge. Creating a circle of care. Yeah, we love that document. Love that. Circle of care, building a circle of care, getting definitely the worksheets, getting creative and finding community, circle of care, the resources other professionals have mentioned. Great sharing, everybody. Thank you for sharing all of your wisdom with us. Find companionship for clients that have no one to help. The worksheet, some of our friends are going to be using the worksheets. I love that. Please keep your comments coming there. We really appreciate that. We appreciate you being here. We appreciate everybody sharing. We learned so much from everybody and the wisdom that you did share with us today. Thank you for being here. We do like your feedback on our services. So if you can take a moment and click the QR code, or I'm going to send this out in the follow-up email. If you can also fill that out later and let us know. We want to improve. We want to have a good session for you next year. Tell us what we can do to approve. Friends saying, recognizing when they may have received service previously that weren't helpful, right? And build rapport with them. Educate staff in our day program. Yeah, 100%. Take this back and educate your staff. You're going to get a copy of the recording today. You can share it with them and they can listen to that on their own as well. So in addition to doing my link here for us, click the link that Laura has in the chat here to sign out. If you're not getting that in the chat right now or it's not working, don't worry. I'm going to send that to you in the follow-up email. Again, remember, if you did not register for the session through the Rutgers Continuing Education Office, register for the session or give us your email in the chat here, or else you're not going to get the follow-up email so you can sign out. So thank you. We are here for you at Care to Caregivers. We are here to support you going forward. We support professional caregivers as well. So please reach out and please call us if there is anything that we can do to support you going forward. We look forward to speaking with you again soon. We wish everybody well, and everybody have a great summer, and reach out if there's anything we can do to help. Thank you, everyone. Thank you, everyone, for being here and for your participation. Thank you, friends. Be well. Thank you, friends. Thank you, everybody, for sharing.